Hi there, Tim here from Active Podiatry. I hope you're all well today. So I just wanted to make a quick video and talk a little bit about bunions. Now, the reason I'm doing this is on my website, just checking through my blogs and realised I didn't actually have one on bunions, although, which is strange because, I get a lot of inquiries, I get a lot of people coming in to my practice complaining about bunions, and I spend a lot of my time doing a bit of myth busting and helping people with this very common issue. So I thought, well, I need to address that. So this morning I wrote a blog, which is going to go up on my website. Feel free to check that out. And I thought I'd do a little video to go along with it. So bunions, first of all, what are they? So a bunion happens when, here's a foot, you're going to see here, and here's the big toe joint. You can see that big bone there is the first metatarsal. And this is the big toe joint here. And a bunion happens when the big toe joint gets pushed across towards the outside of the foot. And because the joint then opens up, the body forms extra layers of bone to protect the joint from further damage. So you get these bony calluses on the side of the joint, and that's the lump you see on the inside of the foot around the big toe joint, and that's a sort of classic bunion. And as time goes on, the big toe goes across more and more, and it starts to sort of cross over the other toes and cause problems with the minor toes. So that is essentially what a bunion is. Once that bony callus forms, you can't get rid of it other than by having an operation. Which works really well. The surgeon will take off the bony lump and straighten the toe, and after a little bit of recovery, you're back to normal. You've got a nice looking foot again. But of course, a lot of people don't want to have an operation. It spooks them a little bit, and I don't blame them. It's not a pleasant prospect, and you should always avoid an operation if it's not absolutely necessary. So now we know what a bunion is. What actually causes a bunion? How do we get bunions? Well, essentially, you're going to have to blame your parents or your grandparents, because that's where you get them from. It's a genetic marker, it's an acquired deformity that you pick up. It's to do with the shape of your foot that you're born with, and certain people just have a tendency to pick them up. And it's actually more common in women than men. That's just the way it is. There's a greater percentage of women that have this. And that led to the erroneous conclusion that it's caused by tight-fitting shoes, stilettos, high heels, that sort of thing. It isn't. That's not the cause at all. You can wear perfectly sensible shoes all your life, and if you have a tendency to get a bunion, you're still likely to get one. So don't blame the shoes. Obviously, it doesn't help if your shoes are too tight and they're squashing your toes. But we know that there are barefoot tribes in different parts of the world who have bunions. So it's clearly not shoes. That said, it's not going to help if you're wearing shoes that are too tight, and that's when we get on to talk about what factors might aggravate your bunion and make it worse. So now we know what a bunion is. We know what causes it. What are the issues with a bunion? Well, the first issue obviously is one of pain and discomfort. You've got this lump on your toe, the toe's getting pushed over, and that can cause varying amounts of pain and discomfort, either because the shoe's too tight or because the sort of overload of the joint can stress out the muscles, tendons and ligaments around the joint and cause foot pain that way. Not pleasant at all. Surprisingly, bunions aren't always painful. Not everybody who comes to see me about bunions comes to see me because the bunion's painful. It's because they don't like the look of it, and they can't get shoes to fit, those sorts of issues. But they can become painful, and if that's the chief complaint, then fortunately there are things that can be done. And the first and most obvious thing is, if the pain that you're getting from your bunion is due to it being squished by a tight shoe, this is where we come back to tight shoes, then don't wear those shoes. Make sure you have a shoe that has plenty of room to accommodate the bunion. And it can be as simple as just getting a lace-up shoe rather than a slip-on shoe, where you can adjust the laces at the front, and you can make more room in the front of the shoe to accommodate the bunion and make it more comfortable. Sticking with the shoe, the other quality of a shoe that's quite important is, if you think about the mechanics of the big toe joint flexing up as you push off the ground, With a bunion, that mechanism isn't so efficient because the big toe is not aligned properly. So you can get a lot of pressure underneath the joint, and what can happen is you can roll off onto the second and third toe joints here, causing a overstrain and a different pain issue here. So if you're wearing a shoe that's flexible and it's not supportive, then you're much more likely to put stress on that joint. You're much more likely to put higher loads on the minor toe joints, which aren't designed really to tolerate that load, causing other forefoot pain issues. So if you have a stiff supportive shoe like this trainer here, my old London Marathon shoes, which always come in handy for these demonstrations, then you're less likely to have high loads through the big toe joint. It's going to help the big toe joint to work more efficiently, and perhaps a decreased likelihood of the weight shifting across onto the minor toe joints. So a shoe with laces, a stiffer inner sole to help keep those forces away from the big toe joint, and obviously a decent amount of cushioning underneath. That's all going to help make your bunion more comfortable. So what else can we do? Well, the other thing that we can look at is the overall strength of the muscles within the foot itself, particularly the muscles around the bunion. And hopefully what I'll do is I'll link to a video and show you a really good exercise for strengthening the muscles around the foot. But basically, with this sort of misalignment of the toe, the muscles that support the big toe joint itself can become weakened, as can the muscles around the foot itself. So a way of making the foot more stable and relieving pain at the same time is to strengthen those important little foot muscles, if you like, and call the core muscles of the foot. And there's some very simple exercises that you can do to strengthen those muscles and just make your foot a more stable unit. If it's more stable, if it's stronger, and it's less likely to get overloaded and become painful. Now, again, I've got a series of exercises that I put up on YouTube a while ago called the Foot Gym, and those simple exercises can really help strengthen your foot and reduce the risk of overload. So it's footwear, it's doing strengthening exercises for the foot, and of course the lower limb. Foot's only as good as the supporting limb above it. And thirdly and finally, something that can really help a lot with this type of foot pain, with bunion pain, and this is coming with a caveat, which I'll get to in a bit, but orthotics can help to offload the big toe joint, offload the big toe joint, help to make that sort of push off more efficient, further reduce the risk of weight transfer from the big toe joint to the minor toe joints, reducing the risk of overload there. And if you reduce loads through the big toe joints, if you make the big toe joint more efficient, then you reduce forces and you reduce pain at the same time. So orthotics along with a supportive shoe are really an excellent option to make your foot more efficient and reduce the risk of an overload type injury and pain. Now, what orthotics will not do, and this is really important, they will not cure your bunion. They're not going to straighten your toe. They're not going to roll back time and get rid of the lump on the side of the foot. It's possible they might reduce the progression of the bunion deformity if they're done in a proper way. There isn't really any evidence to support that, but there's some clinical reason that might support that point of view. But mainly the use of an orthotic in this context is to reduce the destructive forces going through the big toe joint and make the foot more efficient and more comfortable. It's really important to understand that, what orthotics will do and what they won't do. And if you understand that, that they are a really good option. So finally, we come back to surgery now. Nobody wants to have an operation, but at the end of the day, if you can't get shoes to fit, if you can't address the pain from your bunion, then it becomes a risk-benefit conversation that you'd want to have with the surgeon. And let me tell you that when I came into this profession, bunion operations were appalling. They caused quite a lot of trauma and recovery was quite long. these days there's a lot of operations you can have. I'm not a surgeon, I'm not claiming to be any kind of an expert, but there are lots of different ways of sorting a bunion out with a surgical procedure, and it really is quite efficient and quite safe. But obviously that's a discussion to have with your surgeon. But hopefully you see there are a number of things you can do to make your bunion more comfortable and make your foot more efficient, and perhaps buy you a little bit of time, if nothing else, before you have to have an operation. So yeah, that's really about it. I just wanted to kind of clarify, do a bit of myth busting. A lot of the issues around bunions are about that. I find it's just managing people's expectations, and the good news is there is an awful lot you can do. It's not your fault. It's not the fault of the shoe. It's just the way it is. But there are ways that you can manage it. So I hope that's useful. If you have any questions or comments, you want to give me any feedback to this video, if it resonates with you, if it's helped you, then do let me know. Feedback is always brilliant. And of course, get in touch in the usual way if you want to talk to me, if you want further information about how active podiatry I can help you with your bunions. Anyway, take care, and I will speak to you soon. Lost my button.